All right. Assalamu alaikum. Bismillah, salatu wassalamu ala rasulillah wa ala alihi wa sahbihi man wala. So, inshallah, ta'ala, we're going to have a discussion with this distinguished panelists. Alhamdulillah, I'm very glad I don't need to be on the panel, but just asking questions. To set up our weekend, thinking about this Learning Institute, about mosque health-based education research tools, we want to talk about the intersection of Islam community organizations and Muslim health equity. And to do that, we have three individuals here who come from different disciplinary and actually sectoral backgrounds within what might be considered the healthcare ecosystem in our society. So we have Sister Fatema Mirza, who is the executive director and one of the founders of Warrior Free Community, a 30-year resident at Rush, and she will, inshallah ta'ala, be going on to fellowship in palliative medicine, inshallah ta'ala, shortly. And she has been involved with Warrior Free Community and the Initiative of Islam Medicine, perhaps when my beard was not gray. And we have Munir Sheikh here, who is the vice president of Bayan Islamic Graduate School, vice president for academic affairs at Bayan Islamic Graduate School. So as I said, three individuals from three different sectors of the healthcare ecosystem, all, however, involved with Muslim communities in various ways. So to start the panel conversation, I would like to kind of pose a relatively easy question for each of you, but it relates to where you sit. So in what ways do you think your organization interacts with the notion of health, particularly Muslim health?
So Worry Free Community is actually a community health organization, and we separate the public health from the community health. So everything we do is from the community health lens. Every program, every action, every phone call, every meeting, it brings that aspect of health and in fact wellness along with it. And we have our methodologies that actually guides every action that we do.
Okay.
So I would say I'm part of multiple different communities that interact with health and being Muslim. Just from a work perspective, I'm a resident at a large urban medical center, and we're providing care to the community of all backgrounds, races, faith. And I think when we're interacting with the community, we figure out what resources are available and what we can provide, and how we can do that in a very equitable way. I walk into every patient's room knowing that I'm Muslim, and if anyone mentions faith, that gives me an opportunity to mention faith, and it gives me an opportunity to build a community with them. Other communities that I've been a part of is my own mosque, which is local to Chicago, and work that I've done with different nonprofit organizations, and seeing how we can focus on building healthcare-based initiatives to help support the needs of our community as well.
Assalamu alaikum. Yeah, so, as an academic institution, our students come from different communities, as I mentioned previously. Many of them are leaders in their mosque communities, sometimes third space communities. And health is one of the elements that comes into conversation. There are many other issues, alongside health and community health that people are concerned about in terms of transforming their neighborhoods, transforming, the community around them, and providing more resources and services. I would say, questions of like the unhoused or addictions to various things, and then just generally health, and nutrition. These are topics that I think are being broached by our students and our faculty and other community members who might be interacting with our institution. And I think what we're seeing now is these folks who are doing this work in the community are trying to become more systematized, to interface with different social service entities that are out there and really build capacity. And health has to be a part of that. And I think that there's an understanding that, if you're going to start a community garden, for example, that feeds into the issue of community health. And so there are projects of that nature that I think many of our students are inspired to take on because they see some of their peers doing that, whether it's in Memphis or in South Central Los Angeles or in other places. So I would say health, while it's not a specific curricular topic, it ends up becoming part and parcel of the conversation, whether it's a spiritual care conversation, whether it's a theological conversation or a Islamic legal conversation. Um, the issue of sort of, what is our purpose as a community? How are we strengthening society? Because we see today in today's climate, right, that we can't really rely necessarily on where we might have thought we could rely on certain consistency with respect to government support, grants, and agencies. Right now, all of that is very much in flux or has been kind of decommissioned. So it just strengthens the resolve for, I think, our community to really take on these challenges and kind of do for self, which is something, of course, that has been a part and parcel of the African American community's perspective on how to be self reliant and how to build capacity and strengthen one's community without an expectation necessarily that there will be others who come in and kind of save the day. We have to do that work ourselves. And I think that's the ethos that we're trying to support and promote.
Thank you for that perspective. And I think we went from perhaps a embedded healthcare system perspective to kind of a more expansive one. And I asked you that question about how do you engage or how does the organization engage with health, getting at the notion. So now here's a follow-up. Do you think there is a singular notion of health that your institution or your sector that you work in promotes? And what would that be?
Indeed. So we take health as a spectrum, and we actually are looking to define more in terms of health, in terms of wellness, and rather than having a sick care system. Right now, for as long as I've been serving in the healthcare industry, we have looked at every aspect through a negative lens, and every issue that either it's a diagnosis, it's a prescription, it's a treatment, or an intervention. So where exactly is wellness in when we talk about health? We don't see it, and we don't know what is it to be normal. I've asked that definitions when I was in first year college. I have yet to find that. So
in the communities that I'm a part of, just speaking from being a medical resident, a lot of times the medical conditions that we are dealing with, we divide them into being acute and chronic. And a lot of times how we divide those determines what we do with them, right? If you have an acute medical condition, you're going to treat it, you're going to do things for it, you're going to try to continue on. And a lot of times it's dealt with differently, right? I think that in our own community, in my mosque, I see that same acute and chronic issue, right? How many of the uncles and aunties have diabetes that's uncontrolled? But you still find them sneaking donuts after the namaz. How many people, you hear about it, oh, so-and-so had a heart attack. That's an acute condition. They have to go to the hospital. They're going to get cured. But the chronic medical conditions, high cholesterol, that contributed to the heart attack, right? Uncontrolled diabetes. Those things are chronic, and our community doesn't take them as serious as something that is acute. And I think that that's a shift that we need to make in our mind that, just because something has been ongoing, just because our community has a narrative that it's okay to have high sugar, it's okay to have high blood pressure, doesn't make it okay. It doesn't make it a chronic issue that's in the back. Rather, it's going to become something much worse if we don't pay attention to it. I think that's something that I've seen in my own mosque, I've seen in my own community, but I see it all the time in the hospital, regardless of the communities that I'm taking care of.
Thank you. And this mic is for recording, right?
Yes.
Yes. Right. So it's not going to be an in-room mic necessarily like we had before. So to answer the question, I think one thing that you said in your introduction about the kind of disconnect between, the health community and then the mosque community, I think, that's a serious issue that needs to be addressed. I think from where we sit as an institution, I mean, I've kind of given some illustrations of the kinds of projects that I think our graduates are and our students are working on. But kind of stepping back for a moment, thinking about sort of the foundational curriculum, which is in Islamic studies, it really comes to sort of a theological question of understanding. Yes, we have reliance on Allah subhanahu wa ta'ala, and we're satisfied with his decree. But at the same time, we have to be empowered to understand that we have agency as human beings and we can make interventions utilizing science and, good data and good research. And again, this kind of flows into the challenge of the contemporary conversation that's happening in our country, because there's a lot of people who are deniers of science or they're conspiracy theorists. And not to say that every endeavor is foolproof, but that's what science is about, is constantly testing your assumptions and making adjustments. It's an iterative process, right? So I think from our perspective, establishing a sense of confidence in the intellect is one element that I think, end up inculcating, because if you're reading scholarly works, regardless of which field those works might be in, hopefully you are getting to a point, that you're appreciating the effort that has gone into delineating ideas that we can grapple with and we may agree or disagree with on different issues. But I think that and the theological sort of foundation is really crucial, and formation of the student, but also what that student goes back to their community with and inculcates in terms of an outlook that's positive, that is, sort of empowering. That's really where I think we see how we can support the conversation around health and defining it as something that obviously has to be preserved and maintained with dignity. It's, the five before five. It's one of those things that we have to preserve and strengthen as much as possible.
To follow that up, so this is great. So you left out that sort of theological question. So we've spoken a little bit about, you spoke a little bit about Islam now in a sense. You spoke about organizations. The third thing was about health equity. So I'm going to move there for a second. Why is health equity a goal for our community? So you don't have to speak from your organizational perspective, but now just where you inhabit, right? The multicultural nature of your being.
So I think, just thinking about what we hold as Muslims, right? We believe in the Ummah. We believe that we're a part of humanity. We believe in the fundamental dignity of humanity. We're all Bani Adam, right? So that gives us a sense of connection, globally or, with humanity in general. So I think that's kind of a foundation. And if that is the case, then notions of like supremacy or notions of distinction in some form have to be counter, I think, to our fundamental disposition. So that is the door through which equity has to be entertained and taken seriously. That, there are areas where they're under-resourced. We have to analyze, why is that the case? What kinds of discriminatory practices have made that possible? Nutrition issues, what kind of material is being utilized to produce the food that we have access to, and what kinds of good foods or not so good foods are available in different neighborhoods. These are all structural kinds of issues as well, and they're political issues. So I think when we think about health equity, we have to also be able to engage with those broader questions of the dynamics of power in society and what we can do to intervene and play a constructive role.
I definitely echo that. Something that I guess I do often when I'm, meeting a patient for the first time, to ensure that I'm providing or making it clear that my care is equitable is, I always say this phrase. So today's Friday. So I would say, today is a Friday for me at work. For you, today is one of the worst Fridays that you will ever have. And my job is to make your Friday easier, not the other way around. So please tell me what you need from me, and I will do my best to provide that for you. I say that when I meet every single patient, and it has been foolproof for me in that I get to establish a connection, right? When I walk into a room, yes, I am Muslim. Yes, I am a doctor, but I am also human. And I think in healthcare, when you come with the hierarchy that comes with medicine, there's residents, there's fellows, there's attendings, but it's just also doctor, patient. There's a vulnerability that's created when someone is sick and someone is healing or treating, right? Obviously, we know that all healing comes from Allah subhanahu wa ta'ala. We know that, right? I am but a means by which to provide some sort of treatment, some sort of semblance of answers. But I have to walk in with humility because what I am providing is the same for everyone. The hope for answers, the hope for treatment. And so to me, health equity comes in knowing that whoever I get to meet, I treat them the same way. And I provide them with the resources that I can, that I would provide to my own family, to my own parents, right? If they are struggling to find a place to stay, I have to connect them with the case managers and see what we can do. Of course, in an ideal society, we would be helping everyone. This is not an ideal society. And so we have our limitations. But being upfront with the people that I'm taking care of is something that I hold as an amana. And I think by starting there, to me, that's how I find that I can at least promote health equity within the position that I have.
This is excellent. Thank you so much. And I do echo for both of them. Yes, I wholeheartedly agree. I would just add this aspect to it is health equity is just not health related to health. It's actually related to freedom and justice. So health is something by which you can control the masses. It is a fact that it's an aspect to enslave people. So whoever controls health will actually controls your thought, your time. They will control how you breathe. They will control your future. In order, if any society that says it's a just and free society, they got to prove themselves. They have health equity established in their country. If they cannot simply do that, ensure the fact that everyone in their country has equal access to the best quality of healthcare that this country can provide, they should not have that claim to fame. So to me, health equity is just not a matter of providing or treating people. It's literally, it talks about a country's political political views and their.
Both of you, both Munir and yourself, spoke about the political and the structural, right? So I'm going to ask this question that wasn't on my list, and then we'll have the final question in time. From a perspective, and Dr. Ummesalmah, you can also chime in, from a perspective of where we are at presently, with, let's say, I'll label disinterest, disenchantment, disgust with the political system, and as we see the dismantling, perhaps of another dis there, a dismantling of the healthcare structures. What do you think is the Muslim response to that? Right? This wasn't on my list, but both of you. So what is the Muslim response to that?
So this matter of health equity did not start with OBA. It has always been there. OBA, the One Big Beautiful Bill, and the defunding of many of the healthcare institutions that we have seen under that One Big Beautiful Bill. This health equity issue has been there even when CDC was first put into place. And even though the CDC has been about 70 years old now, it has failed to establish health equity. So I think from the Muslim perspective, we as Muslims need to understand and define our positions as to what do we mean when we say a free and just society. What do we mean? What are our metrics? What are our measures? What is the guidance that Islam has provided? Avicenna's book, The Canon of Medicine, is still considered one of the master texts in the healthcare industry. So it's not that this concept is new for us. Health is an economic multiplier. How we use health and how we use the parameters for health actually determines the prosperity of the nation. So we Muslims need to come to terms and need to have that unified agenda and a unified mission.
I appreciated your kind of calling back to the historical legacy of medicine, and not just individual scholars and the text, but the infrastructure, meaning the institutions, the hospitals that were, essentially developed in Muslim civilization. But in terms of our current state, I think obviously as a community, we need to invest in our own clinics and health centers. And when they're established, and we have examples, they're established to serve everyone. So I think that mindset is already present. We just need to build more capacity as far as our internal operations and the partnerships that we might develop with, like-minded communities or institutions. But in terms of what's going on in the US currently, we have to debate and decide, like, what kinds of policies are we willing to support or oppose, even as we draw from our tradition to do what we want to do. How are we engaging the reality of the fact that policies are being set and made by a variety of people, or a process that involves many, many different people with different ideological perspectives, red state, blue state, whatever. But do we want universal health care, for example? Would we advocate for that as a Muslim community? Maybe many of us would. Maybe would say, oh, we see what's going on in other countries. There are pros and cons that are going to be debated. But on the whole, is that a direction we want to move in, or we want to support alongside other people? There's always pitfalls and challenges with that, because anytime something is perceived to be a collective endeavor, even if it's for the public good, it's quote socialism or quote communism. I mean, these terms are bandied about without a real understanding of their specificity and their history and their actual import. So that's something we can confront and take on if we want to do that. But I think we have to think about how are we helping shift the nation in a certain direction that we think is good for our community, but also just good for everyone, right? And health equity, I think, obviously has to be part of that. One possibility could be a more equitable access to basic health care, which maybe universal health care would provide. Maybe there are other mechanisms to achieve the same goal, but I'm just raising the issue that simultaneously, while we do things that we have capacity to do and expertise within our communities to do in the health field, we also need to think strategically about how we're going to engage the system as it stands and shift it to the extent that it can be, knowing that there's a capitalist component to it, and there are other large institutional factors, multinational corporations, et cetera, et cetera. So nevertheless, we're here. We have to engage in some capacity.
Okay, so this is the last question. I know it's Maghrib time for us here. So this is the last question. So, mashallah, in front of you, you have 25 plus individuals who are going to spend their time coming from, you heard earlier today, different backgrounds. If there was one thing that you would like them to focus on changing, right? So I don't want to focus on the obstacle necessarily, but one thing you would like them to focus on changing within their own circles of influence as it relates to Islam and Muslim public community health, what would that one thing be?
For me, that one thing would be talking to your peers and unifying the vision and mission with respect to Muslim communities' health and with respect to Muslim communities' priority. Let's have all the institutions have a unified mission. The visions could be different. The vision is something which is in our heads, and we want to see that. It could be a building, it could be a community, it could be a program. But the missions can be unified. If the missions are unified, then we will all march towards the same destiny. If the missions are separate, and we're all not marching to the same in the same directions, we're all going to end up in different places.
Okay, I'm gonna cheat and give two. But number one, I would say for your circles, tell them to really advocate for themselves when they're in a healthcare system, especially if they're Muslim and that's important to who they are. We did a study with Dr. Padela that talked about how so many people want different things in the hospital. They want a prayer space, they want halal food, they want medications without pork and alcohol, right? But a lot of times they don't find those to be available. Tell the people that you are interacting with, that you're taking care of, that it's okay to ask for these things. Not even just okay, it's their right to ask for these things. I'm in healthcare. My job is to take care, like I said, to cater to the people that I'm taking care of. If they want a sajada, they want a janimaz, I should try to find one, right? It goes for all faiths, but tell the people that you are taking care of that it's okay to advocate for their faith and their faith-based preferences. The second thing, because I'm applying palliative care, I would say that please talk to your communities about making sure that they have mechanisms in place to have a power of attorney, making sure that they have living wills, that when they are getting closer to the end of life, that those decisions are being made by the people that they trust. My own mosque did an event. There were so many people. So many of them were older people, right? They didn't know where to find the forms, who to talk to. They didn't have children to, figure these things out. Look at the elderly in our community and provide them with those resources. It's an amana for us to take care of them. So make sure that the people in your communities are advocating for themselves and their faith. And then for the people that need to make decisions regarding who will take care of them in the future, give them the resources to be able to figure those things out.
I know maybe not everyone here is affiliated with a particular mosque or something like that, but in general, if you happen to be part of a mosque leadership, or if you're organizing events at mosques, I think it's important to incorporate more programming that deals with public health and other kinds of services. I know a mosque in Southern California, when there were fires going on in Orange County a couple of years ago, and I mean, we always have fires every year, but in one instance, about 2 years ago, one of the mosques in Orange County became a staging site for the fire trucks, so that the first responders, emergency services had a place to rest and get their meals, or decompress, and then go back out into the field. I know there are some mosques who have become voting centers, when elections happen. I know some mosques that, when COVID shots were being given or testing was happening, they opened their parking lots for that process. And food pantries, of course, are also very commonplace in many mosques now. I think those are wonderful initiatives, and I would just encourage us to collectively think about how we can integrate our masajid and institutions into our broader communities so that they do understand that Muslims are of value to the society, and we have many good things to share in addition to our faith and our commitments to important values. We're trustworthy, we're honest, we're committed, we follow through on our commitments, we're kind, we're peaceful. All of these things we don't have to talk about. We just do it by being of service, and that's really what I would like to see continuing to develop in the United States. Particularly, I see wonderful examples, and I think that if we continue in that process, along with serving our religious needs, as our masajid do, I think that would be an ideal scenario.
Jazakallah khair to the three of you. Alhamdulillah, this is a lot of food for thought. I hope you take those thoughts with you, inshallah. In respecting time for Maghrib, I think we should close. I would like to have had an engagement, but we started late, and I apologize for that. But Jazakallah khair to the three of you. Barakallahu feekum. Everybody, will see you tomorrow morning at 8:30 bizabt, inshallah ta'ala, to start. So please be here and have a good evening, inshallah. There's a prayer room across the way. We will show you where it is, inshallah. Assalamu alaikum. And to those online, thank you for joining.